Hi there and welcome. I'm so excited to explore the pelvic floor movement with you and just all the options that it has to offer. This program is certainly not just for pregnant women. Everyone could definitely get a lot out of these classes just because they are so diverse and they really explore the movement in a whole new way. We are honoring the methodology and ideology behind the Pilates work. So if you've done Pilates before, all the moves will be very familiar to you. So in our first class, we will be addressing the pelvic floor. And today I really want you to explore the pelvic floor movement focused on the mat. So you don't need any props. You might need some pads for your knees if your knees are low but more sensitive for kneeling work. But first, we need to talk about the importance of balance and exploration when it comes to the pelvic floor. We often think it's all about Kegels, right? Well, the good news is that you don't have to just sit there and do Kegel exercises, but we can really move the whole body, exploring the mind and body connection without any limitation. You will learn how to regain the ability to contract the pelvic floor and how to relax it completely. The contraction is as important as the relaxation part. I want you to walk away from today's class feeling super good in your pelvic floor, super good in your pelvis, in your hips, finding that connection with your abdominals. And I really want you to feel that full body integration. We will be referring to our body as an onion, and you will explore the feeling of peeling all those layers and going deeper and deeper into the body. The truth is that our pelvic floor responds to almost every movement that we do in our life. It even responds to the stresses that we feel, the emotional or the mental stress. So, what does it mean in pregnancy? Well, the pelvic floor supports the entire weight of the baby, an extra fluid, an extra blood. And that's a lot of load for those muscles. We need to maintain that supportive quality of the pelvic floor. The pelvic floor has to prepare to open and relax so you can go into the labor and the birth in the way that you desire. So we need to have that balance of strength and flexibility, the strength to support, and then the ability for the pelvic floor muscles to stretch along the cervix. When everything can stretch, everything can open. All this work, of course, will also help going into a recovery stage. And all this work is very important for anyone with pelvic floor imbalance. So there are three parts of the pelvic floor work that we are going to be talking about today. We are going to talk about lengthening, relaxing, and strengthening. We often think about this idea that we need to strengthen and strengthen and strengthen our pelvic floor muscles. And of course, for some people that it's true, but what physios, gynecologists, and physical therapists are finding that there is an over tightness within the pelvic floor in women due to the whole bunch of different reasons. And if you have a pelvic floor imbalance, your symptoms will be very similar to the ones when your pelvic floor is too tight or too weak. This is why it's so important that we get familiar with the feeling of lengthening, relaxing, and strengthening those muscles, not just tighten, tighten, and get stronger. If you have a pelvic floor imbalance, your symptoms will be very similar to too tight or too weak pelvic floor muscles. We need to get familiar with the feeling of feeling the body, when it feels like it's lengthened, how it feels when it relaxes, and how it feels when it's actually strengthening. And these are such a deep muscles that it takes a lot of mind and body connection. I will go over some movement that will definitely help you with it. And we are going to explore all the different movements of the pelvis. We'll go forward and back and side, side. We'll do the rotation. We'll find the pelvic bones and bring a little bit more awareness into the body. Let's get started.